people come into the pharmacy and ask us about signs and symptoms that could be related to sleep apnea. I would like to ask you 5 questions, and if you answer yes to these, you may want to consider talking to your doctor further. The first question is, do you snore? Secondly, are you excessively tired during the day? Third, have you been told that you stop breathing in your sleep? 4, do you have high blood pressure? And number 5, if your neck size is larger than 16 inches in women or 17 inches in men, you may want to consider talking to your doctor about sleep apnea. So you've answered yes to these questions. You may want to know, so what do I do now? The first step is to call your doctor and set up an appointment. If your doctor feels that you are a candidate for sleep apnea, they will go ahead and have their office schedule you a sleep study. Your sleep study is typically done in 2 separate nights. The first night is just to diagnose you with sleep apnea. The second night, which is often called a titration, is to determine what pressure will best benefit you. Sometimes this can be done in one single night, which we call a split night study. This is not very common, and you should anticipate a second follow-up study. After your sleep study, the sleep technician will forward your results to a pulmonologist. He or she will review the findings and diagnose you. After the pulmonologist has reviewed the results, they will forward your sleep study to your doctor. Your doctor in turn will send the sleep study and a prescription for the equipment to the provider of your choice, such as Meyer Pharmacy. Once the equipment provider of your choice receives your information, we will contact your insurance company. Some insurance companies will require a prior authorization, so we're looking at a time frame of about 4 weeks. Now, depending on your insurance and their requirements, it could be a little less or a little more. Also, some insurance companies will require a follow-up appointment after your first 3 months. So now that you've been diagnosed with sleep apnea, check out our next video to learn about the equipment you'll be using.